Okay, good night, everyone. Good night. Welcome to Dare to Tell, a place where you can come and we can talk about anything, any topic. You can talk about your trauma, your hurt, your pain, success, whatever it is. And so tonight, I just want to welcome you all to this platform. And I have with me my co host, which is Sister Leslie. My name is Donna. I'm the host. I just wanted to introduce myself. And so tonight we have a special guest. Her name is Desiree. And so tonight we will be talking about a little bit about mental illness. And so let me put this disclaimer out there. We're not medical doctors in any way, shape, or form. Okay, this is what we have researched. Desiree is working in this field, and so she will give her opinions and what she has learned and what she knows regarding mental illness. And so Desiree, could you please introduce yourself and tell us just a little bit about yourself and how you get into this job?
Well, yeah, my name is Desiree, and I am a social service worker. I switched career about 2 years ago from hairdressing to social worker. So happens, I would just say God gave me this job, pretty much. And I'm working with an organization that deal with mental health. They're intake worker, the mental health and organization. And so I deal with a lot of mental health cases coming in, pretty much from youth, adult, depends on what age it is. I deal with the mental health trauma crisis in this organization. And so I'm not a professional. I'm an SSW worker, and I just worked in the field, and I'm able to deal with and do a couple of courses on mental health.
Okay. So my first question is, and I've done a little bit of research myself. First, for those who don't know about mental health, what is mental health?
Okay, and so basically mental health include emotional, psychological, and social well-being. It's affect how we think, feel, and act. It also help determine how we handle stress related to others and make choices. Mental health is important as every stage of our life, from childhood, adolescent, and through adolescent. Let's say over the course of life, like pretty much this is coming from CAMH. So most of the information is from CAMH, which is
Mhm.
mental health. CAMH is pretty much a mental health organization
Mhm.
that helps her with mental health, as well as the system that the government funded. So they do most of their researches, and most of this is coming from them. This, this basically says that over the course of life, it experienced mental health problem. Your thinking, mood, behavior, it could affect, and many factors continue in mental health problem. So biological life experience, trauma, family history, most of all those are pretty much what mental health is about.
Okay. We every now and then we will be asking questions. Sister Leslie or myself will be
Yeah,
asking questions. Whatever it is that you're not sure about, of course, because we none
for
of us
sure.
knows it all. You know what I mean?
Yeah.
What causes mental health problem? Or you probably answered that in all that you said before.
Yeah, so yeah, that's pretty much what causes it is like daily pretty much daily lifestyle. Stress, anxiety, behavioral disorder. There's a list of stuff that cause mental health,
Mhm.
and it's caused from like mood disorder, substance use,
Mhm.
eating disorder. These are parts of mental health,
Mhm.
personality disorder. Most of these are the cause mental health. It's also the fact that daily life pretty much
Yeah,
cause mental health.
yeah,
You
stresses.
know,
Because
yeah,
I've
especially.
noticed that since COVID happened, a lot of people have been going through mental health issues. And before I even knew what it was, and I'm sure a lot of people are like me, um, before I even knew what mental issues were, most of us would probably thought this person's going crazy when it really isn't about being crazy. It's so much more to mental health issues. And so if somebody's going through any kind of mental health issues right now, what does one do if they're worried about their mental health?
Because it looks like, anxiety,
Mhm,
and, it looks like stress, it's stress and everything. Um, Most people with mental health problem, if you have, believe it may not be real. Sometimes the research is showing that we can basically reach out to that person. What it looks like, it is affect people. So here it tells you that for younger people, mental health problems don't only affect them like children. So the stress of life is like, you're trying to basically be like, say Jamaican,
mhm,
and my kid comes home and he's acting out and everything, and
mhm.
I'm looking at him as if, okay, he's rude.
Right.
um, in the meantime, there's something else going on, some sort of trauma that me I might not know, or I might cause,
Mhm,
my child. So it could be a trauma from, sometimes we yelling at them and,
mhm,
pushing them to do things that they don't want to do, could cause trauma. They've been hurt somewhere, or divorces that cause trauma. So a lot of times trauma is basically from coming from us, as well as, started from the age of, however, parents died,
mhm.
a car accident. So it all depends on what, divorce, parents divorce. So many
Mhm.
things that cause trauma and mental health in
Mhm.
a lot of our society right now, as we say.
Yeah,
Yeah.
yeah. You have any questions, Sister Leslie?
Um, this is a pretty big topic, and I think
It is.
it's hard for us to cover everything in the one
We
show.
won't. Yeah,
Okay.
we
When
won't.
we talk
If
about
it's
mental health, though, to give people I guess, a better understanding, was there an easy way to define it, for one? And two, how do we recognize? Because someone might be depressed. Is it mental health? What if I'm suffering from anxiety? Is it mental health? So is there something that, like there's some hot buttons, or there is some signs? What are the things that I will look for to know that someone is suffering from a mental health issue, right? Because I can see someone acting weird and label them as mental health, not necessarily being mental health. So is there like a checklist or some way to assess
What
whether
I,
someone has mental health
mental
issues?
health, yeah.
what I
And so
when I sorry,
so
when
basically
I
it
did a
says,
research,
mhm,
oh my bad, just
that's
one
okay,
thing.
go ahead.
When I did a research, it said two of the most common mental health conditions are depression and anxiety. And I was shocked by that because I'm saying so everybody that's depressed or has anxiety is some form of mental illness.
It is, because it affects your state of mind.
Right.
So that's why it's labeled as mental health. It
Yeah.
affects your state of mind and how you're able to function.
Right. So you kind of answered your question somewhat.
I was
It's
asking if there's a
right.
checklist,
Yeah,
whether
No,
there's a
pretty much.
checklist to be able to look,
no.
right, and say, okay, yes, 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 yes. And
Yeah.
at what
Yeah.
point, in addition to that, at what point do we refer people, or even suggest seeking medical attention?
Mhm.
And so there's basically some early signs that is listed for mental for knowing that someone is going through a mental health situation. Is like eating or sleeping too much, or too little, pulling away from people, usually activity. So sometimes kids don't want to do activity, or sometimes your teenagers are sleeping too much, or they don't want to get up, or they don't want to do anything, having low energy or no energy at all, feeling numb, like nothing matters. They don't want to do anything. They don't want to go anywhere. having headaches and pain, feeling helpless and hopeless, smoking, drinking, or using drugs as usual, feeling unusual, confused, forgetful, and on edge all the time, angry, upset, worried, or they're scared, yelling, fighting with families and friends, experiencing severe mood swings that cause, problem in relationship with families, having, thoughts, memory loss, getting out of, different things getting out of their head, hearing voices, and some of these voices believing things that are not there, thinking harmful to themselves as well as to others. These are some of the signs basically that, they are going through something for mental health, and these are some of the signs that you look for. So once you look for those signs, and what you see some of those signs in, especially your young people, you know that there's something going on, and that, we need to pay more attention to them.
Okay.
Okay.
Yeah.
In terms of treatment, in terms of treatment, so let's say I recognize some of those signs in anyone. Obviously, if someone has a mental health issue, not everyone is receptive to outside intervention. So if we have someone and you want to enlist them for treatment, how would you recommend you approach it?
Um, Most likely, when you're recommending them for treatment, it's they have to want that treatment first of
Mhm.
all. Um, Most information that I've gathered simply says that some of the ways we can try to communicate with them differently, we can start like from inside, trying to support them basically. Um, we try to, work things out with them, try to calm them, try to get them to talk to us. And of course, once if they gone to a point where we're not communicating well with them, or we're not reaching them as per se, because it would say we try to communicate with them, try to do things with them that they like, or that we may want, see them go through. And if they're not agreeing with it, like some of the signs that they're showing, we have to basically at least find someone that can communicate, at least step down to their level, more like
Mm,
it, trying to communicate. If they don't want to get up, there's a reason why they don't want to get up. If they don't want to move, there's a reason why. So, and if all that fails, because roughly no matter who it is, whether they're seeing a counselor, a psychiatrist, or a doctor, if they don't agree to it, there's nothing they can do. Like
Mhm.
for example, if you want them to see CAMH, there's nothing. If they don't want to go, you can't do anything. But we can still reach out for support. Places like, crisis centers. Now that the government is putting so much into mental health, there is a lot of free sites that they can go on. If they don't want to go out, we can always go online and find free counseling or free support, mindful things that they can do just to support them until actually they're ready to accept the fact that they're going through something and they need support.
And that's key, that what you said, when they get to that place where they say, I want that help, because there's so many barriers, I think, for somebody seeking help, in this,
Um,
afraid of, it's a stigma out there regarding mental health. And some might say, oh, I'm not that bad. There are others that are worse than me. And some might be afraid of the negative outcome, or sometimes people don't even know where to go get the help. And I'm glad that you said what you said. Um, some people might think, oh, I can do this on my own. So there's so many barriers, I think, to this mental health issue. And it's difficult identifying or expressing the concerns, of these people. But I read where poor mental health can cause significant disability for younger people. It is associated with an increased risk of antisocial behavior, and that is so key, because I've seen it. And but before I recognized so many stuff, regarding mental health was, was there. I had no idea. Substance abuse, as like you said, um, suicidal attempts and all of that stuff. So when it comes to all this barrier, like how do we help these young people? Like, we can only try to be there as a support system for them sometimes, but it's hard for some of them to open up.
And that's a fact too, because when I do an intake for, say, most of my intakes are done by a lot of these young people coming out of jail, right? And they've gone through so much wherein they're even diagnosed from inside there, because a lot of them go through it, and the first thing they're diagnosed, so they're diagnosed with things like schizophrenia, they're diagnosed with all kind of mood disorder, depression, anxiety, and then they sign them up so that they can come out and get some support. But one of the thing I notice is while I do the intake, I get most of the trauma part of it, because they get to say a question that are asked, then they start pouring out. And by the time they start pouring out and everything, but then you do the intake and they just disappear, because you provide them. What I do is provide them with a caseworker, and that caseworker is normally there to help them. And they just disappear because they're afraid to go through or to talk about what's going on with them, what's they've been through, like traumatized by, some of them were just traumatized by going to jail. And then they come out of jail and then they have nowhere to go, because parents don't want them back, because they've been through so much with them, and they go to jail. Now that they get a relief that they're in jail, they just give up on them, and then they just end up on the streets. And this is where the anxiety kicks in more. And at before I started doing the job that I'm doing right now, realizing that anxiety and depression were something that can actually kill you, really, because most of them do like the drugs to get rid of the voices in their ears, or and drink to get rid of the what's going on, and then they end up on the street. So at that point, it's like, what can you do for them? Even though you're trying to reach them, I'm trying to reach them, and we're trying to support them. But if they don't get back to me, there's no way I can support them. And then they come out of jail because, they get their freedom, but they don't know how to handle it.
Yeah.
So they go right back in there because they don't have a support system. Like
Yeah.
80-90% of them, when they come out, they don't have a support system. So they're
Wow.
looking for support. And that's one of the biggest thing, because once they have a support system, somebody waiting for them when they come out and say, okay, this is where you're at, this is boundaries, this is rules, then it helps them a bit, and they're more receptive to get treatment or to get some support. But
Yeah.
once they come out and they don't have no support, then there's nothing much we can do for them. They just end up right back in jail.
Wow. And that's
Yeah.
hard when you really don't have that support. And I can
Yeah.
understand why, not having the support and you have to go back on the streets. That's kind of hard. Like, that's a hard life for anybody. I
Mhm.
remember a while back, a long time ago, I met this young man. He was going through some stuff. I didn't know what it was, but sometimes you can tell that somebody's going through something. And I
Mhm.
had a conversation with him, and he said to me, I remember when he said to me, there's so much stigma around, people being in trouble or whatever it is. Because he said, as soon as you start opening up, people start judging you, they start treating you differently. And because of that, some of them shut down and afraid to talk about it because they are afraid that people are going to judge them, see them as crazy and all of that stuff. So it's really hard. And I like for me, I would know the first thing, and the only thing I could say to him was, you have to talk to somebody. He said his family members would judge him, his friends judge him, and all of that. People are calling him crazy and all of that. And he says, I'm not crazy. I'm just going through some stuff from my past. He would have never said anything more than that. But like,
And
just
it's just the trauma that they've gone through too. But what I find is, like, when I started doing the intake and you ask one of those open questions that triggers something, and then they started just going on, and they're emotional and everything. And just by talking to someone about it, just by talking to me at the end of the conversation or the intake, they feel so much better. And it's like if they have somebody that they can reach out to, they don't want you as a medical or a psychiatrist or whatever it is, but a family member that is willing to only just listen and not judge would actually help a lot. I say this because I had three kids, like three wonderful kids, but my son was my headache, and it still is. And earlier, I did not have the knowledge about anxiety, depression, and realizing that going to school can cause them to be depressed or anxiety. Teachers in the classroom can cause them to have these
Wow.
schizophrenia, all these stuff. Being told that they can't do anything can cause
Oh,
this. And I did everything for my son without realizing that he was going through something. I
yeah.
reached out to ChemH, I found him a psychiatrist. I've been to school, I got him tested. I did everything that could have possibly done for him. But at the end of the day, I realized if he does not want to change at that point, there's nothing else I could do. And there's one of the research says a lot of us turn to different things to cope with the stress of life,
Yeah.
um, like the anxiety and depression. For me, I turn to God for my healing,
Yeah.
and what my son put me through makes me stronger in God. And for that, I did not have time to think about the anxiety and the depression that I was going through because I was so busy trying to support him and then
Mhm.
trying to pray for him. The more I pray for him, the stronger it gets for me and the more courage I get out
Mhm.
of it. And not to say I had a wonderful teacher that, teach me how to pray and teach
Yeah.
me the word. And for me, that was my solution to the depression and the anxiety. But then I did not know that it was that depression I was going through or the anxiety. And so I
Yeah.
overcome it by praying and then getting stronger in the word. But it's hard for them to understand that they're going through something and you
Mhm.
are trying to support them,
Yes.
right? And so for my son, the lesson learned was he had to want to do what he wants to do, and there was nothing else I could do.
Yeah.
And it's the same thing with a lot of these young people coming and in and out of jail and
Mhm.
going smoking, drinking, overdosing on things is
Mhm.
because they're just sick and tired of life and they feel like they're getting nowhere. So
And
unless
they
they
feel
have
like they have
somebody
no
to,
one.
no one. So unless they have someone to support them in everything they do, basically don't agree with it, set boundaries, but support them. We're still gonna have, these young peoples, and not just young peoples, but because of the pandemic, a lot of elderly, a lot of adults are
Yep.
going through it.
Yeah.
And I am surprised and amazed at how many people have been diagnosed with these, schizophrenia,
Mhm. Mhm.
bipolar, anxiety, depression, and we're wondering where does all those names come from? And they're just dumping on medication. So a
Yep.
lot of things are coming out because of this,
Yeah.
schizophrenia. Doctors are diagnosing your child with medication,
I
and they
know.
are afraid of the medication.
Yeah.
So the thing is that I don't know how we can basically get them to basically understand what's going on with them, but from most of the research is like they have to get support somewhat. Support has to be there for them to hold on to.
Yeah.
And that's why most of the organization that we have now they provide caseworkers for some of them. So
Mhm.
I would say for parents that are going through some stuff with their kids and they're not able to do it on their own, to reach out to some of these organizations that dealt with crisis, provide caseworkers for them. And some of the caseworkers, which are really amazing, will meet up with them, sit down, talk, connect, and all that stuff. So that's one option that I find will helpful because you have someone there to support that they may feel more comfortable
Mhm.
talking to than the parents or a friend or something like that.
Mhm. Yeah. And like you said, even for adults, um, having just somebody that they can talk to as well,
Yeah,
because they go through stuff. And I find that not only with mental issues, that I find that there are adults that actually do go through depression and anxiety a lot, not just because of mental issues, but because of the word menopause, because it comes
menopause.
with that a lot. So it's like, how do you differentiate? I guess depression is depression and anxiety, so it doesn't even matter. It's still a part of mental, health. Um, I read some of the factors that could potentially result in poor mental health. I was so shocked to hear some of them. I know, like you said, the abuse, trauma, social isolation or loneliness, um, social disadvantage, poverty, people that are in debt, severe or long-term stress. Those things, I had no clue that those things are, some of those things are factors when it comes to poor mental health. Unemployment, losing your job, homelessness, like we talk about with the young people, somebody going through domestic violence, being bullied, all of those stuff. It's just amazing how um, vast this mental illness thing is, how many factors can actually, you know, how many factors there are regarding poor mental health.
Yes, because it's basically it's like who does it affect, and everyone has mental health and willing to experience challenge regarding their mental health being. But not everyone will experience mental illness. So there's like a difference between the mental health and the mental illness. And the mental illness directly affect all Canadians at some time, either through their own experience, family members, friends, and colleagues. So, it just affects pretty much every one of us. One
Yeah.
out of every five Canadians have mental health.
Wow.
Yeah.
It's oh my God, seriously. And so like I remember when I became aware, before I became aware of what mental issue is like, when you see, sometimes you would see people on the street, because I grew up in Jamaica and I grew up thinking that everybody on the street is mentally ill when they're not, or have some kind of mental issues. So when you come to another country and you see people on the street, the first thing you think, they're
They're crazy.
mentally ill, not knowing that they have mental issues, yes, from being homeless, from, all kinds of stuff that's going on from their past, PTSD, you know what I mean? Post traumatic stress disorder, it's stuff like that. So we don't know what people go through. And this world can be so cruel. Like we can be so cruel, so judgmental, That's why we have to take the time out to actually, if you see somebody going through stuff, like you said, just kind of be their support system, try to be there, if they don't want to talk about it, there's nothing you can do. But it's just, this thing is just, it's vast, it's huge.
Yeah, it's a wide field with mental health. And yeah, like you said, just been there, even if they don't want to talk, it's just knowing that somebody is right there at the time. And it takes a lot out of me, and just to get to know that all these things that goes on with mental health, it's coming from a different sides, like, be a caregiver, those mental health that affect adult children, teen, younger adult. It's just a wide range. And kids as young as 5 or 6 can have mental health. they're lashing out at school and there's something going on, and if you don't know the root cause of it, then you just think that kid is rude,
Yeah.
and we assume that they're rude, we throw them aside without finding out what's going on with them. And then they get to a certain age that we should have realized that that something is wrong, that my child wasn't like that, something is going on. Let's see
Mhm.
what side of resources out there. But at this point, I can tell you there's a lot of resource out there for mental health. At this point, there it's tons of organization, there is crisis centers, and it's just for us who knows little about it, little knowledge, to actually try to support them, to reach out, to call someone, talk to someone, on
Mm.
the line. And the internet is just such a big, wide range of having resources when it comes to come to mental health. And our young people or youth, even for our seniors, are going through mental health.
Yeah,
So it's a
absolutely.
lot of things going on when it comes to mental health. It's just not enough support. Like at home is more the biggest support should be.
Yeah.
It's just not there. Because
Wow.
as a working mom, I'm tired. I come home from work, I'm tired. You didn't
Mm.
go to school today. Why didn't you go to school today? And I'm yelling at him, and he didn't just, he has something going on. And maybe he
Yeah.
can't explain it to me, but I am hungry because I'm working so hard to put food on the table, and all you have to do is just go to school. And
Mm.
those are some of the things that I learned, that, if he doesn't want to go to school, then there's an issue going on. There's something underneath there. What
Mhm.
is it? And instead of being patient, I'm overworked. So how can I be patient when I'm overworked and my child is acting out? I don't know why he's acting out. So I guess that's some of the things that we as parents should be looking into as well, and try to communicate more to
Yeah.
find out what's going on before we try to
Yeah.
basically kick them out of the house, or lock them out
Mm.
and yelling at them and stuff like that, which cause
Yeah.
more trauma to them.
Yeah. Because I
Yeah.
find that with a lot of West Indian parents, because of how we grew up, I find that with a lot of West Indian parents, they don't listen. They
Yeah.
don't listen. They don't take the time out to listen to their kids,
Yeah.
to ask what's going on with you, to really sit them down and have a talk with them. It's like, you're too rude. Why didn't you go? It's all the yelling like you were just
Yeah.
talking about. And I think they now need to be aware of when you see a difference in your child, a different kind of behavior, or even things that they say that they don't normally, say. Take that time to talk to your kids and really, really listen, because we never know what they're going through. They could be
Yeah.
they could be bullied at school. It could be a lot of things.
And it's
So
one thing I would give out to young parents or young mothers, like, instead of yelling, find out what's going on. And if they don't talk right away, you have to keep on with it.
yeah.
And so at some point they're going to have to talk, because you're pushing, you're getting involved. Sometimes it's just we not showing up at school, showing up at a game, showing up at, in our children's life. So we're too busy, not being busy in their life, but being busy trying to provide for them. And
Mm,
that's one of the trauma that kids that goes right up with. So that you're never
yeah.
there, how you know what's going on in my life, because you're never there. And that's like one of the big trauma for
Yeah.
kids growing up, and then they get to adult, and then they're on their own, and now they're just lashing out.
Mm.
Yeah.
Sister Leslie.
I know, I was just thinking about the piece where she said it was about talking to your kids. And you made that point too with a lot of West Indian people. They don't really stop to listen. So there's a video actually that they show in schools where it teaches parents how to listen more and speak less. This way, when your child comes home and they're downloading, you're taking all the information in and not necessarily having to rebut,
Mm.
but analyze it, walk away and analyze it. And then after you've analyzed it, listen to the key points that your child is making, and then come back and, reassess and ask again so that you can understand what's really happening with them. I know since marijuana has been legal, a
Legalized,
lot of the
yeah.
young people are experimenting with it. And
Mhm.
that's another thing that's causing mental health issues
Yeah.
because a lot of their brain cannot handle, they don't, their brain doesn't have the capacity to handle the amount of marijuana that they're smoking. So then what ends up happening, it triggers, right? Mental health issues and they have a nervous breakdown. So
Yeah.
that's another hot thing that's happening recently
Yeah.
since pot has been legal.
Mhm.
So they already are probably suffering from depression and they're trying to find ways to cope with it and ODing on these other external sources, right?
Yeah. Yeah.
Yeah.
So
They're
those are other
doing
key factors too that affects the mental health and
mental
triggers
health.
something
Yeah.
else
Yeah. Yeah.
because they're trying to find coping mechanisms.
Yeah. That's the thing.
So
Yeah.
if we can recognize some of those signs early and
Mhm.
even try to get intervention, it
Yeah.
may help, right?
Yeah. That is true. Yeah, I tell you, one of my nephews had gone through some mental issues at one time. They were ready to put him in the psychiatric ward. And I tell you, Desiree, I tell you, it was just God that came through because when I looked at my nephew in that hospital bed, I could not believe it was him because the nephew that I knew during COVID, he became a totally different person, not knowing what he was going through. And he never talked about it. You know what I mean? And it was getting in a car crash that he walked out of without a scratch that landed him in the hospital, even though he wasn't hurt. But my sister recognized that there was something going on with him. And so, everybody intervened and stuff. And, I prayed for him and stuff. And we all got him to go to one of those places where he could be helped, mentally and in other ways that you could think of. And now he's doing good, thank God. He's working on himself daily. It's a process, and we try to just always keep him, encouraged and stuff like that. But not many, like you said, have the support. And that is the tough one.
Yeah, I
Mm,
think that's the biggest issue when it comes to our young people.
mhm.
The pandemic did a number on them. They were not able to go to school. They were not able to go out. They were just more hooked to the internet, and they learned so
Isolated.
many different things, isolated. And as families, they don't. Nobody's talking because everybody has their own gadgets playing on. The little one is there with the phone or the iPad. He's in his room with the music at his ears, and after a while friend they don't want to talk because they just shut away from their friends and everything. And
Mhm.
then some parents are still working, and there's no communication even though
Yeah,
everybody was home at the time too, because everybody is in their separate space
right.
and not knowing what was going on. So what used to bother them, school used to be a coping mechanism for them. Friends used to be a coping mechanism, but then there was no more of that. And then, they just go all out and they start yelling and screaming, and before you know it, they go out and they start having,
Yeah,
difficulty communicating, and they get into trouble. And then they're
yeah,
out there into trouble, and the first thing they get is thrown into jail, and they get thrown into jail, and then they saw a doctor and they're diagnosed with mental health, and then they just hold on to that, depressed
mm,
or whatever it is. So there's no
mhm,
support to say, okay, I'm going to support him there, I'm going to call him and it could be the one thing for my son. What I did when he got arrested was that I make sure I hooked up a line. You go and look up these jail lines. And so he connect with me every single day. Whether I'm at work or wherever it is, I make sure I answer that phone. And sometimes he wants to talk to someone else, and I connect him, to his sister or whatever it is. So I keep him connected, so that way it doesn't feel like he's going through this all by himself.
Yeah.
And eventually he said one day, "Oh, mom, if I had listened to what you said, I told him that you needed to be there. I said, I'm happy you're there, because if he wasn't there, then he would have been killed already. But I told him God has a plan for him. I told him that if he did not go there, he would not been able to tell me that, I should have listened."
Yeah.
Um, and I understand sometimes, even for God, their words going through them, but they too busy. So they can't hear those little voices that is trying to communicate with them. They won't even listen to me. I wasn't even important because I was too strict, or, I don't understand them, or I don't know nothing what I'm talking about. And all of a sudden, the friends that knows him, they don't communicate, they don't call to say, how is he doing, what are you doing? And he is realizing now that he is there, but also because I open that connection door so that
Right.
he can reach me at any time. And
Mhm.
at some point on the phone the whole day. But the fact that he was able to reach me and I was able to open the connection door, I feel that whenever time he is ready for society, he's coming back because he has a support system.
Right.
A lot
Right.
of the young people that I met and do intake on, they end up in shelters.
Mhm.
Shelters are not literally not for people,
They're not homes.
and they go there and it's not what they're used to. They
Mhm.
lose their stuff, they're sleeping on floor, and before you know it, they're back on the street.
Yeah.
And what type of support do you have? None, right?
Exactly.
So I'm trying to connect them to a support, but then you can't find them again,
Yeah.
right? So the most important thing for our young people is to try to get to them, connect with them. Like, have a family member that can relate to them, relate to the things they do. I mean, they're not going to all do the best thing, and we're not expecting them to do the best thing, but we do have to communicate because we're living in a different generation.
Yeah.
I mean,
Absolutely.
14-year-old, 13-year-old stealing, killing. What is going on in that?
Yeah.
What is going on that we're not paying attention to as parents and family members that
Yeah.
allow them to reach the stage that they're at,
Right.
you know? So, and that's one of the thing where the communication part of it.
Yeah. And I think it's kind of hard too for some parents. They might not know where to reach. I mean, the resources are there, but
Yeah.
not many people know how to go about getting those resources because you have parents like single parents that have their kids at home and they're working two, three jobs. Nobody's there for the child. Nobody's there for that young person. So a lot of times, that child, gets connected to even the wrong crowd because mommy is working hard to pay the bills, to put food on the table. And so they're connected to these different people. They start getting in trouble and all of that. So it's so much like, I mean, I'm glad I wasn't born in this era. I can
This for
honestly say
sure.
it's not even
Yeah.
funny. But these young people are going through so much.
Yeah.
It's easy for society to say, oh, that's a bad child, but we don't
Yeah.
know the root
What
cause
they're
of,
going for.
where it began, so it is a lot. So do you have any numbers or resources that you can, say of now where if somebody is in trouble or somebody needs to talk, who they can call?
Um, and yeah, for once, just if like the numbers are not there, but just go online and start and type in crisis and crisis line. They're not coming out with a 988. We should connect sometime this year for crisis. 211 is very important when it comes to crisis. Your kids are going through, or you're going through crisis for support, because there is support out there that will handle the child, the mother. There are organizations that comes together for all members of the family, if it's a men groups and stuff like that. But it's just more important 211, I would say. And no matter what you're going through, 211 will connect you with any crisis intervention, any shelters, just about abusive, even if it's for abusive, you need 211 and they will connect you. There's also central intake. So central intake would be, yeah, we don't have the number, should have had it. Yeah, but there is all central intake that all knows all organizations, all the connection. And so if you dial 211, they're able to connect you to central intake, and that will take you there. Other than you can go online and just type in, crisis intervention crisis line, and a whole list will come up, or organization that you want to. But if you dial 211, they will give you the exact connection that you need to get to a mental health. And at some point, 988 is coming out as well for crisis mental health, and people are able to connect with that as well too.
Well, that's good
So
to know.
yeah, so as long as you basically go online and do like CAMH, mental health from CAMH, and then you have all that list comes out. And if you can't, you can just go to a CAMH center and just get your information, or if someone, you can carry them straight to CAMH, and they will basically, you can just ask to get admitted at CAMH as well. So that could be an option for, even for parents that have a young one that is willing to take the support.
Awesome. That's awesome.
Yeah,
Good to know.
yeah.
Leslie, do you have any final word as we're getting ready?
Those were my questions. Again, she's made some key points, just staying connected, having that support system. I think it helps to really keep people connected, and
Absolutely.
then you feel more comfortable to share.
Mm,
If you're not connected, then you're not, if you're not in the loop, then you don't know what's going on. The awareness
right.
is not there.
Yes.
But there's a lot of resources that are available online. People can be anonymous. A lot of people have that hesitancy to go forward because they might be labeled or stigmatized. But
Yeah.
you can also seek out help from the crisis line and different crisis centers by not having to identify yourself, just calling in saying, I'm facing this issue and I need someone to talk to.
Okay.
So if anybody is depressed, anxious, suffering from any mental health issues, there is resources available where you don't have to expose yourself, and you just reach out to someone.
And they
Okay.
can always call 911 as well. 911. I know sometimes the police come, but now that they have groups that are able to recognize that, they are working with mental health. And as long as they called, you're talking to someone and they said they're going to commit suicide, they're going to kill themselves, or they're going to hurt themselves, you can always just call the police and they'll show up, and, they'll either take them to the hospital, CMH. It's not all bad when you call them. It
Yeah.
just means that you explain what that young person is going through. They'll go knock on the door, find out if they're okay. Like we do that a lot with our caseworkers. Sometimes they're talking to someone and they say, oh, I'm just gonna kill myself, or I'm not in a good mood. We dial 911, they shows up, and they'll let you know if they're okay or they need to go to the hospital. And they can always call a crisis line themselves, and that crisis line will have someone connected to talk to them as long as they want,
Awesome.
to talk about whatever it is going on with them or stuff, and if they need other support. So there are
Awesome.
lots of options out there. You
Mm,
just have to connect with them.
okay. That is awesome. Thank you. Thank you so much, Desiree. I really, I really learned a lot, and there's so much more to this thing.
Yeah.
But I do
I,
appreciate you. I thank you so much for coming on and telling, telling us what we need to know, and for others to also know, you know what I mean? So, but I do appreciate it. I thank you for
you're
your
welcome.
time.
I'm happy to do
Yes,
that. I'm very happy to do that.
good to know. Yeah, we could probably do
All
a
right.
part two later on.
Yeah,
I would love
for
that.
sure.
Yes,
Yeah.
Sister Leslie, thank you so much for being my host, my host tonight.
No problem.
For my audience, I thank you so much for tuning in. And all I ask for you to do is like, share, and subscribe. We are Dare to Tell. So you can check us out on YouTube and on IG. If you do have a story, you can email us at daretotellall@gmail.com. And thanks again. God bless you. Have a wonderful night or evening wherever you
Wow.
are. And I do love and appreciate you for listening. Thank you. Desiree, thanks
Good
again. And
night.
we'll see each
You're
other.
welcome.
Good night,
Have a
everybody.
blessed night.
You too.
Bye.
Bye-bye.
Good night.